back. This is part 4 of 4 on your Intro to Community and Public Health Nursing. So I hope you've already watched the 3 other videos. If you have, great. Grab your colored markers and your pencils and your notebooks, and let's get started. Now, we have a couple of things we're going to talk about today, and really it's just that I want to explore the essential components of community and public health, really just finalizing our understanding of the framework and structure and things that are involved in public health and community health nursing, so that in the future lessons, we can really plug more information in. So we're going to describe and explore these essential components of community health. These essential components include social determinants of health, levels of prevention of disease, research, policy and law, ethics, community partnerships, and social justice. So let's go ahead and get into it. Social determinants of health are factors of the environment where people live and work that impact health, risk factors, and quality of life. In other words, where you were born and raised has an impact on your health and how your health outcomes go. And things around where you're born and raised that can have an impact on your health include economic stability of the community, access and quality of education, access and quality to healthcare, neighborhood, structures and safety, and the social and community supports and resources that your community has. So one way that community health nurses improve the health of a community is to work towards improving these social determinants of health. The next component of community health nursing is the levels of disease prevention. So this is kind of like the upstream thinking. Always the goal is to prevent illness and disease and injury from happening, because it's easier to prevent it and it's also cheaper to prevent it than to treat it. So there are 3 levels of prevention: primary, secondary, and tertiary. I want you to write PST on your worksheet. Primary stands for prevention, P for prevent. This is, we're going to take actions to prevent illnesses from ever happening in the first place. So a prevention activity example would be getting your flu shot to prevent you from ever getting the flu in the first place. Secondary would be screening, S for screening. This is where we find things early so that we can intervene early and treat early. This would be things like blood pressure screenings, diabetic screenings, mammograms. If we can catch things early, they're going to be easier to treat. So secondary stands for screening. T stands for treat, treating already present illnesses or diseases. So this is someone who has chronic hypertension, and now we're just treating them to prevent them from getting worse. This is someone who already has high cholesterol, and we are just treating them to make sure that they don't get worse. The next component, essential component of community and public health, is research. Public health policies are guided by data. This goes all the way back to Florence Nightingale. Thank you to her. And the strength of evidence, the strength of the research, should be considered by nursing. Now, research in the public and community health world is not just about universities or hospitals doing research. It's really about community-based participatory research, because it takes a number of stakeholders, maybe fire departments, religious organizations, schools, police departments, universities, to all come together to agree on different research efforts and data collection for their neighborhood. And those are called community-based participatory research projects. Now, there are 2 organizations in the United States Department of Health and Human Services that help guide research and best policies and practices for community health. The first one is the United States Preventative Services Task Force, and that is directed by the AHRQ. This organization offers clinical preventative services and health promotion recommendations for individuals. So they're going to recommend what screenings you should have each time you go to your doctor. So the reason why we get mammograms as females starting at age 40 is because the AHRQ's United States Preventative Services Task Force said that that is a service that they should offer to 40. The reason we start getting prostate exams as males at 50 is because of the recommendations of this task force. They look at all of the research out there about every one of these topics and make recommendations. And they make recommendations based on an ABCD scale. A means super strong research, absolutely do that service. B means moderate research, do the service. C means, I don't know, maybe don't offer the service. It may or may not help, look at your individual patient's needs. D means the research is not supportive of that service. And I means there's just not enough, we don't know. The other organization, also under the Department of Health and Human Services, is the Community Preventative Task Force. This is funded through the CDC. Now, while the United States Preventative Task Force talks about preventative services for individuals, the community one talks about preventative services for populations. The next essential component of community and public health is policy and law. And some might argue that it's one of the most effective tools to improve health. Now, there are a number of things that we can think about, laws and regulations that have helped improve health in the United States. Things like the Affordable Care Act, Medicare and Medicaid, raising the drinking age from 18 to 21, car seats requirements for children's, value-based purchasing for healthcare acquired conditions. So if someone gets a pressure ulcer in the hospital, if someone gets a UTI in the hospital, if someone gets a central line infection in the hospital, the CMS will no longer pay for any services from that infection. So hospitals are really motivated to prevent hospital-acquired infections and pressure ulcers while patients are in the hospital. So patients are getting better care. Same thing goes for repeat visits. Hospitals want to make sure that patients go home from the hospital and stay home from the hospital, because if patients revisit the hospital and have to be readmitted within 30 days, the hospital gets no payment for that readmission. So it really puts the onus on the hospital to ensure that patients are going to, that they have the resources that they need, that they have the education that they need to stay healthy once they get healthy and leave the hospital. Other policies and laws include things like immunizations for schools and the Clean Water Act of 1972. There are so many more healthcare laws and policies we could talk about, but here's a few just for today. The next thing we have to think about when it comes to core concepts related to community health are ethics, ethical principles, and ethical dilemmas. So ethical principles include things like autonomy, the patient's right to make their own choices, which goes right along with self-determination, being able to choose for oneself. Beneficence means doing good. Non-malfeasance means doing no harm. Fidelity means being trustworthy as an organization or as a professional. And distributive justice means equal access to resources for all. All of these ethical principles certainly play into community health decisions, and sometimes we get into an ethical dilemma, a problem, as it comes to individual rights or community rights. And we saw a lot of that in the news as it related to things like the COVID vaccine. So if we knew that everybody got the COVID vaccine, we would see decreased prevalence and incidence of disease. But then how much do you weigh community rights to have a healthy community with individual rights to make their own choices over their own bodies? And that's the ethical dilemma we can see in community health. I have a whole nother video about ethics and nursing. So if any of these terms aren't ringing a bell, I'll link that one below and you can refresh on that. Community partnerships is another essential component of community nursing. There are a number of partnerships that are required to make communities thrive in terms of health and wellness. It takes collaboration from government agencies at all levels of government, from the local hospital systems and EMS systems, lay people in the community, meaning non-professionals who are volunteering in their community, the not-for-profits in the area, maybe it's the intimate partner violence not-for-profits or food banks, the religious organizations where many people seek advice and resources even for their health, and then the universities in the area to do research. All of these partnerships are a key component of community health nursing, and working together with stakeholders really ensures a healthier community. The final element is social justice. Unfortunately, there is systemic racism in the healthcare system in the United States. And we see that in policies that were implemented like the New Deal, and practices and norms. We see it in data outcomes where there are poorer health outcomes for BIPOC people in our country. We can see the physical impact of chronic stress from racism in the BIPOC community. And we can see it in even where we put our money as a society. Did you know that people in federal prison receive twice the healthcare dollars as Indigenous people and reservations? So lack of funding for Indigenous people's healthcare is another example of social injustice. And as community health nurses, we are responsible for health equity and stopping systemic racism in our country. One more, and that's the nursing process. Just as a reminder, the nursing process is fundamental to everything we do in nursing. And it's one thing that community health nurses use as they do their job. They assess, they diagnose, plan, intervene, and evaluate. It's just instead of doing that for an individual, they're using that system for a community as a whole. That's going to wrap it up for our intro to community and public health. There's more videos about community and health in the future, so make sure you watch those. Thank you so much for studying with me today. And remember, you are smart, you are capable, you are loved, and you got this. I'll see you next time.